Well, good morning. I'd like to welcome everybody to the February 2014 ACIP meeting. I'll turn things over to Dr. Pickering for some comment.
Thank you, Dr. Temte. Good morning and welcome to the February 2014 ACIP meeting. The proceedings of this meeting will be accessible to people not in attendance via the World Wide Web. And we welcome to all the people who cannot be here in person, but who are watching these proceedings. Several people will be with us for the duration of the ACIP meeting to assist with various meeting functions. Most of them are known to the regular attendees. Felicia Betancourt, who is here, and because Felicia is pregnant, this may be her last meeting for a few meetings, but we're glad that Dr. Riley is here if we need her. Natalie Green, that's not the only reason that we're glad you're here, Laura. Reed Walton, Stephanie Thomas, and Chris Caraway, who will be here shortly to help with the computer activities. We have a full agenda today and tomorrow. Today we plan to finish around 6 p.m. and tomorrow around 1:15 p.m. Handouts of all the slides that will be presented have been given to the ACIP members and are also on the tables outside of the meeting room for others who may be interested in having copies of them. The slides presented at this meeting also will be posted on the ACIP website approximately 2 weeks after this meeting. The live webcast videos also will be posted within 4 weeks of the meeting, and the meeting minutes are posted on the ACIP website generally within 90 days of the meeting. They're a little late this time. There are 166 single-space pages, so it takes a while to go through these minutes. But they will be posted, the minutes from the last meeting, by the end of this week. The October meeting, or the members of the press who are interested in conducting interviews with ACIP members should contact either Jamil Howard-Jones or Jason McDonald for assistance in arranging these meetings. They're usually sitting over at the press tables to Dr. Temte's left. We have several guests I'd like to announce. Joining us are two vaccine science fellows from the American Academy of Family Physicians. The AAFP Vaccine Science Fellowship Program is intended to develop a cadre of physicians with knowledge and practical experience in various aspects of vaccines and vaccinology. The Vaccine Science Fellows are Dr. Chris Lupoid from Lancaster General Health in Lancaster, Pennsylvania, and Mary Pat Freelander. Dr. Freelander is from the University of Pittsburgh Medical Center, St. Margaret's in Pittsburgh, Pennsylvania. So I know they're here. If you just stand, welcome, and we're hope that the knowledge we impart to you will be retained forever. I'd also like to welcome two other people that we work with closely. One is Belinda Schoaf and Jennifer Frost, who we will be working with, both from the central office of the AAFP. They are both here, and we welcome them for being here and also for the long-term interactions that we've had with particularly Belinda and AAFP. We now like to recognize some of our international visitors from 5 different countries who are attending this meeting. As your organization is called, will you please stand so that you can be recognized? First of all, we have in attendance 3 representatives from the Ministry of Health in Vietnam and 1 from Vietnam CDC. Secondly, and please stand so we can recognize you as your names are called. We also welcome the head of the Department of Arbovirology and Emerging Viral Infections from the Uganda Virus Research Institute. 2 of our guests are epidemiologists from Morocco's Ministry of Health, and there are also 3 division directors from the Ministry of Health in Kenya, and 2 visitors are joining us from China representing the Chinese CDC. So welcome to all of you. If there's anything any of us can do, let us know. Good. We usually have Minister of Health representatives from member countries of the WHO PAHO, Pan American Health Organization, attending each meeting, but the group will not attend this meeting, but will be joining us, a delegation will be joining us at the next meeting. As a reminder for future international visitors of ACIP meetings, due to recent changes in the Department of Homeland Security policy, Additional forms are required, which will of course require more time to register. So we encourage people to register for the meeting early, particularly international visitors. Registration will be open the first part of next week, so you can register next week and won't have to worry about registration as the meeting gets near. In slide 3, Gene, sorry for not mentioning this, but the next ACIP meeting will take place at CDC on Wednesday and Thursday, June 25th and 26th, so we can mark it on our calendars. And registration for all meeting attendees is required, as you know, and will open next week, as I said, on the ACIP website. With regard to liaison representatives, we welcome Terry Dwell, the new ACIP liaison representative from the Association of State and Territorial Health Officials. Dr. Dwell is a former clinical professor of pediatrics at the University of North Dakota School of Medicine and worked as a medical missionary in East Africa. He currently serves as North Dakota State Public Health Officer and is chair of the Infectious Disease Policy Committee for ASTO. Terry, where are you? Good. Welcome. Thank you. Carol Hayes will join us as the American Nurses Association liaison on behalf of Katie Brewer. Carol, welcome back. And unable to attend this meeting are Patricia Whitley-Williams, liaison representative from the National Medical Association. Ex officio members, Melissa Houston is representing Vito Castera as the ex officio member from the Health Resources and Service Administration at this meeting. Melissa, welcome. Unable to attend this meeting are Mary Beth Hance, from the ex officio member from the Centers for Medicare and Medicaid Services. We request, as usual, that all cell phones be turned off. And topics presented to the ACIP meetings during the course of this meeting include open discussion with time reserved for public comment. Time for public comment pertaining to topics on the agenda has been scheduled at the end of each day, the end of each meeting day, following the afternoon sessions. Time for public comment also may be provided prior to specific votes so that the ACIP members can consider these specific comments in making decisions about how they vote. People who plan to make public comments should visit the registration desk at Dr. Temte's left in the rear. Felicia Betancourt will record name, organization, and any conflicts of interest that you might have to make sure that your comment is heard. There are several initiatives that are underway. There are a couple things that we're trying to do in an attempt to improve and accelerate communication and information delivery. Number one, CDC is launching the vaccine schedule apps. These are downloadable on mobile devices so that you can look at the immunization schedules no matter where you are at any time. CDC is working on content syndication of the immunization schedules between the ACIP and the professional societies that publish them each year. Thirdly, safety issues will continue to be presented at each ACIP meeting. Fourthly, we're conducting educational sessions for ACIP members. We had a great session yesterday on health economics, an overview for the ACIP members and CDC staff, and we're planning a review of grade in the near future for the ACIP members. And then lastly this is the 50th anniversary of ACIP. We will have more about this at a later meeting, but I just wanted to remind everyone about this big event. With regard to disclosures, to summarize conflict of interest provisions applicable to the ACIP, as noted in the ACIP Policies and Procedures Manual, members of the ACIP agree to forego participation in certain activities related to vaccines during their tenure on the committee. For certain other interests that potentially enhance the members' expertise while serving on the ACIP, CDC has issued limited conflict of interest waivers. Members who conduct vaccine clinical trials or who serve on data safety monitoring boards may present to the committee on matters related to these vaccines. However, members are prohibited from participating in deliberations or committee votes on issues related to those vaccines. Regarding other vaccines produced by an affected company, a member may participate in discussion with a proviso that she or he abstains from voting on all matters related to vaccines of that company. It's important to note that at each ACIP meeting, Dr. Temte goes around and ACIP members state any conflicts of interest. Slide four, Gene, if we can get it up. The slide now on the screen shows ACIP website where detailed instructions for submission of names of potential candidates to serve on ACIP may be found. This may be a little bit early, but I don't think it's ever too early really to submit names. And the application for ACIP membership are due no later than November 14th, 2014 for the 4-year term beginning in July of 2015. One last comment. At every meeting, as shown on the next slide on the screen, we provide an update on the status of the ACIP recommendations that have been published since the last meeting. On the slide, you can see that there were 4 publications since the last meeting: the use of Japanese encephalitis vaccines in children, the childhood and adult immunization schedules, and then the updated Haemophilus influenza type B document is slated for publication on Friday of this week. With that, Dr. Temte, it's time for roll call and request for conflicts.
So we'll open up for roll call. State your name, any conflicts of interest, and we'll start with Dr. Dushin, go around to your left.
Jeff Duchin, no conflicts.
Ruth Karen, no conflicts.
Doug Campus Outcalt, no conflicts.
Art Reingold, no conflicts.
Joe Bocchini, no conflicts.
Allison Camp, no conflicts.
Renee Jenkins, no conflicts.
Kathy Harriman, no conflicts.
Tamara Coyne Beasley, my university receives funding from pharmaceuticals for clinical trials.
Marietta Vasquez, no conflict.
Lee Harrison, no conflict.
Laurie Rubin, no conflict.
Lee Pellegrini, no conflict.
Nancy Bennett, no conflicts.
Jon Temte, no conflicts. I'm going to just take a very brief moment to mention a couple things that are of interest. One, from the weekly epidemiological record that came out earlier this month, just noting that since between 2000 and 2012, measles worldwide has decreased by about 78%. Over that 12-year span, an estimated 13.8 million lives were saved by measles initiatives. I mention this simply because earlier this month, at my home institution, a young man presented from southeast Wisconsin with a rash illness, was diagnosed empirically with a rickettsial illness. 5 days later, the measles serology came back from a commercial lab in Iowa instead of the State Lab of Hygiene that is 6 blocks away, and could have done it immediately. And in this amount of time, this was a young man who was not vaccinated. There were 97 patients in the hospital units who were exposed. There were 105 visitors exposed during this time, 362 hospital employees. This resulted in case contact investigations in 18 of Wisconsin's 72 counties. Suffice to say, there were just 4 people who were found that were at risk with negative serologies, 1 infant, and 1 with serologies not known. I think everyone has now emerged from quarantine without developing, but it just reminds us how pervasive these things are, and when they occur, the incredible impact.
And I think, John, after our session yesterday with our economists, I'm sure part of this evaluation will be the cost of this outbreak to the institution.
Absolutely. Now, Dr. Pickering mentioned that we are now in our 50th year of ACIP. And just a couple notes here. In front of me, I have the agenda from the May 25th and 26th, 1964 ACIP meeting that was introduction to the committee purpose and function, definition of the responsibilities, simplification of the immunization schedule, and relationships to other organizations such as the Red Book Committee, the American Public Health Association, AFEB, which I'm not sure what that is. Perhaps someone, what? the Armed Forces Epidemiology Board, thank you, Art. And not mentioned here was AAFP, which was not in existence at that time. I'm just going to read the responsibility. The Advisory Committee on Immunization Practices was appointed by the Surgeon General in May 1964. The committee is charged with the responsibility of advising the Surgeon General regarding the most effective application in public health practice of specific preventive agents which may be applied in communicable disease control. I'll just make a quick mention that the initial committee had 10 members, and the chair was a Dr. James Goddard, who was described in the New York Times Magazine as a wild-eyed crusader with a battle axe flailing boldly. Kind of reminds me of Dr. Pickering. And then finally, the first item on the agenda of note in terms of any immunization was influenza. So with that, I'm going to have Dr. Campos-Outcalt come out and give a brief announcement on the novel influenza vaccine work group.